Hey Sierra Nevadans, it's Brian Evans again. I wanted to give an update about what's going on in the hospital. We gave one earlier this week, but actually I'm going to turn it over to a friend and colleague of mine, Dr. Nathan Clayton, who has some information for you about what's going on in the hospital and also his hospitalist group. Dr. Clayton is the chief hospitalist for Sierra Nevada Memorial Hospital, and he's just been doing a fantastic job, not only through the whole COVID pandemic and making sure that we have what we need to take great care of COVID patients here, but everything that goes along with being a hospitalist and taking outstanding care of our patients. Some of you probably know other Clayton members, Clayton family members in the community. Dr. Chris Clayton and Susan Clayton have been in the area for a long time, providing family practice care to many of our residents. And Nathan Clayton is now continuing on in that tradition. We recruited him to the hospital, and he is our chief hospitalist. So thank you very much for tuning in, and I'll turn it over to Nathan.
I'm Dr. Nathan Clayton. I'm an internist at Sierra Nevada Memorial Hospital. I work for a company called Sound Physicians, which is a physicians group that specializes in inpatient medicine and also critical care. I serve as Chief of Hospital Medicine here at Sierra Nevada, and I wanted to take just a brief few minutes to talk about COVID-19 and how it's impacted our hospital and some of the internal treatment strategies that we have for our COVID-19 patients. So as everyone knows, unfortunately, we've seen quite an increase in the number of cases of COVID-19 nationally. Certainly in California, we've seen an increase in the number of cases. Yesterday, Wednesday, we had a record 11,000 new cases of COVID-19. Nevada County is no different in seeing an increase in the number of cases. As of July 16th, we have 185 total cases of COVID-19. 51 of those are active cases. We've tested about 10,000 of our residents, and we have a positivity rate of about 1.7%. The silver lining for our county, and certainly for our hospital, is we've not seen the kind of surge volume that other places have seen and that we had originally feared. Quite the contrary, we've had what amounts to a trickle of COVID-19 patients, meaning about 1 to 2 COVID-19 patients per week. This places us in a very favorable spot. This means that we have very adequate supplies of personal protective equipment. We have more than enough medical equipment, things like ventilators, more than enough medications. We've taken this opportunity to make sure that we are providing the best standard of care for our patients and every treatment option available. We have a COVID-19 committee that meets every week. This is a multidisciplinary committee, multiple specialties, so hospitalists, emergency department doctors, intensivists, gastroenterologists, cardiology, nephrology, nurses, pharmacy, social work. Basically anybody that's involved in the treatment of COVID-19 patients has input in this committee. We review every single case that is treated at our hospital. We review every medication, every treatment that's given. We make sure that we're giving everything we possibly can to our patients to have the best outcomes. We have had some encouraging treatments that have come along over the past few months. One is remdesivir. This is an antiviral medication that's been proven to decrease the duration of symptoms of COVID-19. Also a medication called dexamethasone. This is a steroid that can be given IV or by mouth. This has been proven in studies to have a mortality benefit, to actually save lives in severe cases. Also convalescent plasma, or CCP. This premise is you take plasma from patients that have been exposed to COVID-19 and they have antibodies, and you give it to patients that have active disease to assist their immune system in fighting the virus. We are enrolled in a Mayo Clinic study for convalescent plasma. Our goal at Sierra Nevada is to give the best standard of care for our patients that we can, to have the best outcomes. Of course, the best outcome of all is to not get COVID-19 in the first place, and this is where I plug things that have been proven to work, things like hand washing, face coverings, social distancing, and if you need us, we're here. We'll all get through this together. Thank you very much.